are going to speak to you today about Technet. So, welcome.
Great. Thank you so much.
Thank you.
Well, yes, thank you for joining us for lunch today. I always like to make the joke, I don't know if you really care what we have to say, or if you just care that we have free lunch. So, regardless, you're here, we appreciate it. And so hopefully we hope you find this to be educational, informative. We want this to be real informal, so as we're going through this presentation, if you have questions, please feel free to just shoot your hand up or just shout out the question and we'll go ahead and answer that for you. And I think there's plenty of food, so we won't find it rude if you get up in the middle and go grab seconds. So again, thank you for joining us. My name is Colin Schwartz. I do business development for Rosti. I work at our corporate office. This is Dr. Tara Schanzenbacher. She works just right across the street with her recovery specialist, Jackie. And so they're about 5 minutes away. And they've been gracious to come over here and give this presentation this morning. So, so what we're going to do is today we're going to go through a brief presentation in regards to something called Technet. And as you can probably take from the name, Technet is something that all of us are starting to face. We probably weren't dealing with it 20 years ago, but with the use of tablets, smartphones, laptops, computers, all of us find ourselves in this hunched over position. Very rarely do you see people looking at their smartphone with really great posture going through it like this, right? It's down like this, and you wake up in the middle of the night and your neck hurts and you wonder why. Well, a lot of it has to do with technology, right? Where you're sitting at your computer and you're typing away, and in the morning you start with a really great posture, and by 2 or 3 o'clock you're doing this. We call it the corporate T-Rex, just doing this. So it can get worse and worse. So what we're doing today is we're going to talk through just a couple symptoms that you can start to feel just from this interaction with technology in general, not necessarily at the workplace, but just technology in regards to owning a phone, a smartphone. And then we're going to go through very specific stretches and exercises. We call them tools for prevention. Things that you can just do on a regular basis, sitting at your desk, you can do them at home, but things that you can incorporate into your daily life to hopefully take away some of that discomfort and that pain that you're feeling from this so-called Technet. And then we'll talk just real briefly about Rosti at the end, just if anyone has any questions. But the main point of this is to really be educational for everyone sitting in this room. So real quick, has anybody heard of Rosti in here? A couple of y'all? Okay, looks like about half the room. Excellent. So what I'm going to do is I'm going to pass it off to Tara, Dr. Schanzenbacher. She's the real expert. She's one of our providers here, and she is really going to kind of take the lead on the presentation and go through.
Thanks, Paul. Appreciate it. Okay, so great introduction, and yes, Technet is most certainly not the medical term or diagnosis given if you do end up seeing a provider for any of these particular symptoms, but the true diagnosis is usually falls under a diagnosis called upper cross syndrome. And so what we're going to do is really break down that postural dysfunction into the more medically inclined diagnoses and what some of these diagnoses can present with in terms of their symptoms. But certainly Technet does draw the necessary attention to the true culprit, which is, our lives these days. Everything from, your cell phones, laptops, all that sort of stuff, and even just being sitting at a desk, with or without a computer. So we've had the luxury of being, we worked for a time in-house at a big technology firm, so I was working with a lot of people that were just, stuck in front of a computer all day, stuck in front of technology. So it really is a risk factor. And so, like Pauline said, our goal is to really go through and hopefully give you guys some strategies to help prevent yourselves from becoming victims of any of these particular conditions. But essentially, Technet refers to the discomfort you experience after prolonged use of any of these technological instruments, okay? Most typically, you're going to be feeling pain behind the neck, pain in the mid-back, arms, shoulders, elbows, all the way down into the hands and fingers. Very often, these symptoms will be accompanied with headaches of tension type, and we'll talk a little specifically about that shortly. And then potentially numbness and tingling into the upper extremities, which gets very concerning to a lot of people, and they don't really think or believe that something as simple as their bad posture can be contributing to numbness and tingling in the hands. We see it all the time, so definitely a correlation there. All right, so understanding the impact of, like I said, upper cross syndrome. So I really want you guys to understand the term upper cross syndrome. It's very simple. When you come into our clinic, one of our big jobs is identifying muscular imbalances, and essentially that's all that upper cross syndrome is. So if you look here, upper cross syndrome describes the compromise in musculoskeletal system which tightens or facilitates the anterior compartment, okay, that's everything on the front side of the body, basically from the chin down to the mid-torso, while weakening the posterior elements, okay? So, like I said, this kind of cross demonstrates a weakness in all of the muscles on the front, a dominance or a tightness in all of the tissues on the front side of the body, which indirectly leads to a weakness or a stretching or lengthening of the posterior elements, okay? Now, one thing you might not know is that if we're chronically stretching a tissue, that is going to neurologically inhibit the tissue. So even though you might go to the gym and you might be training your back or you might be doing your postural exercises, if these tissues for 8 to 12 hours a day are being exposed to that lengthened positions, and you put 1 to 2 minutes of effort into it, countering that maybe a couple times a week, you're just not going to get that full benefit from the tissues because you're inhibiting them all day. So basically, what we're doing here is addressing this muscular imbalance. All it is, it's an imbalance from the front to the back. So to correct a lot of these problems and conditions that arise from this imbalance, it's just putting everything back into its normal working position, okay? So some of the typical muscles that will become very tight are the pec muscles on the front of the chest, all the muscles on the front side of the neck, and even into the jaw. And as a result of that, what you're going to see is a lot of tension being created on the back side of the neck here, around where the skull sits on top of the upper portion of the spine. And then again, that progressive lengthening of those upper back muscles, okay? So,
And just so you know, everything, we're gonna do a couple stretches and some strengthening exercises at the end here, nothing that's too much. But it really counters everything here. What can we do to strengthen these cervical flexors in the front? What can we do to stretch these pec muscles, and so on and so forth? So just everything that we talked about here is kind of incorporated under this umbrella of upper cross syndrome.
and I think another thing that's important to consider, here we are talking about just being in a static, seated, resting position. This stuff can cause you pain. This posture can cause you pain and lead to a bunch of different conditions. But like I said, consider the fact that these muscle imbalances will get carried into your movements. And that's where you become a little bit more susceptible to injuring yourself, because now we're not just stressing out our soft tissues, our muscles, our tendons, our ligaments in a resting position. Now we're taking that posture into anything that we're doing, trying to be more physically active, and that's going to put our joints at risk. And so ultimately you have to look at the big picture. It's not just about having the best posture in that seated position to alleviate the tension on the muscles, but it's also to prevent risk of trying to unwind all that tension when you're trying to be active. So definitely something to keep in mind, that we carry these patterns into our movements, which is a little bit more detrimental. All right, so moving along. Again, so we talked about some discomfort on the back of the neck, but I would say the classic early presentation that you are being affected by Technet is this discomfort felt in between the shoulder blades in the mid-back. So again, it can kind of range from a tension, a burning, you just might feel fatigued, and that's just muscular irritation, okay? And don't undermine that. I see it every day. Some people will have already gone through MRIs or x-rays. There's nothing wrong. They tell me I'm completely healthy, yet my upper back just burns all day long. I certainly never undermine the pain associated with just general strain from your muscles being stretched out all day long. Joint dysfunction that results from that chronic strain in the mid-back. Again, you have to remember your soft tissues, if they're susceptible to that and they're influenced by that all day long, eventually your bones, your ligaments, all of those tissues are also going to start being influenced by that positioning. Now again, there can be some other underlying effects, and it may not just be soft tissue-based pain, but again, those are things that more or less are the long-term progression of the early signs of Technet. And the key player in this type of symptom presentation is simply a weakening of those rhomboid muscles, okay? So one thing I want you guys to understand, this guy here, he's in a good anatomical position. His shoulder blades are squeezed together, he's in a good upright posture. So his rhomboid muscles, those guys right in the center, they're in their normal resting length, okay? But that's not how we all look after we've been staring at our computer for 4 hours, is it? No, we're very, very different. And so ultimately what you can equate this with is basically pulling apart an elastic band and holding it there for 8 to 12 hours a day. That's going to take its toll on you. So that's, like I said, a lot of the times where people's symptoms are coming from, or how they start anyways. Tension headaches. So there are various kinds of headaches, and I wouldn't necessarily say that I ever claim to fix headaches. Oftentimes people are presenting to my office with neck pain, with mid-back pain, and with concomitant headaches as well. There are various types of headaches. A lot of them are biochemical, hormonal, some associated with stress or diet or some other underlying conditions, and certainly we weed those out. But more often than not, the tension type headache is very prevalent and exists consistently with these upper cross type syndromes. So basically, if a patient's coming into me and they're saying, I've got this band-like sensation, it creeps in usually by about lunchtime, after that stress and strain starts to take hold and really create tension around the base of the skull. And that basically is coming from the fact that all of your neck musculature and a lot of your upper back musculature comes up and anchors itself right on the base of the skull. Okay? People have this idea that bones are just, dead matter, but they're not. They're actually highly sensitive, especially the outer lining of the bone. They have something called the periosteum, which is just highly sensitive nerves. So if all of these muscles are pulling so tight, they're going to tug on that anchoring site and really create a lot of irritation and inevitably cause a headache. So when a patient's coming in saying, I have all of these mid-back and neck pain symptoms, and also I have headaches, most likely it's going to be a result of their neck or upper back dysfunction. So we treat the neck area, we treat the postural dysfunction, headaches go away. That's typically what we tend to see. Okay? But again, we certainly make sure that we're treating the right type of headache. Okay? Any questions so far? No? Feel free to put your hand up if you do, okay? Okay, so getting into some of the more of the severe ramifications of upper cross syndrome, thoracic outlet syndrome is defined by basically numbness, tingling into the hands, a weakening of the grip, and just a general feeling of nerve irritation in the upper extremities, okay? Now, what this is caused by is the compression of nerves and blood vessels passing through a region we call the axillary bundle, which is right through this area, and it actually tucks underneath this pec minor muscle. So the shorter and tighter this muscle is, the more compression is going to happen underneath that or around that neurovascular bundle. So it's essentially like pinching a garden hose, okay? So you factor one tight muscle or short muscle plus a little bit of a rounding of that posture, and yeah, you can see how those structures are going to become compromised. And so the main presentation that we'll have actually a lot of patients come in, and you'll see why in a second, thinking they have carpal tunnel. Like, oh, my hands are going numb when I'm sitting at my workstation, and I can get up and I have to shake my arms out, stretch themselves out, put themselves in an upright position, and the sensation in my hands will come back. But a lot of the times, like I said, these people aren't just coming in with the numbness and tingling in their hands. They're coming in with the tension headaches, with the mid-back pain, with all of that neck pain as well. Oh, I'm sorry. And so ultimately, how we counter this, number one, we make sure that we rule out carpal tunnel or any other potential radiculopathy or nerve root irritation from the neck as to be causing any of the symptoms in the hand. And more often than not, we poke around their chests a little bit, or we just observe their posture, and more often than not, it's coming from just a really, really tight pec minor muscle. Okay? And so how can it be confused with carpal tunnel? Well, carpal tunnel, like I said, presents very similarly, except the numbness and tingling is usually a lot more specific. They're going to tell me it's in this specific finger, it happens at this specific time. They may not necessarily have those postural dysfunctions, but likely they will. And a lot of the times this type of, this isn't really referring to Technet, but this is basically as a result of having a job that places you in front of technology all day, okay? You're going to be reaching for a keyboard, reaching for a mouse, overusing your wrist muscles and hand muscles, and inevitably causing compression or pinching of the garden hose in a lower portion of the nerve. So instead of the nerve being pinched up here, like we talked about before, by that pec minor muscle, instead we're going to find entrapments of the median nerve, which is going to be a different distribution usually coming from below the elbow, okay? And we'll be able to sift that out as well. And again, these are repetitive strain injuries. So I get a lot of people that come in, and it's actually really fun. It makes my job a lot more fun. They come in and they're like, I didn't do anything. Nothing happened. There was no accident. There was no fall. There was no trauma. But I'm in agony. I'm feeling pain every single day. And so, again, although we can usually rule out a lot of red flag pathology that maybe we wouldn't be able to fix, we're placed with the burden of figuring out what exactly are you doing on a small scale every single day that could be considered repetitive microtrauma. Carpal tunnel is exactly one of those conditions. Thoracic outlet syndrome, exactly one of those conditions. So hopefully, I mean, you know, like I said, we're trying to teach you guys the early signs that are telling you the whispers. Something's going on. You guys got to get it checked out. So hopefully we're raising some awareness.
I just want to add one thing that just to be clear is like when you have carpal tunnel syndrome, so carpal tunnel, if you have numbness and tingling in like your pinky finger, but not your thumb or like your pointer finger, carpal tunnel really only occurs in these three fingers. Is it these three and half finger ring?
These three.
These three, right here. And then if you're feeling numbness and tingling in your pinky or your ring finger, it's actually a different nerve. It's your ulnar nerve, so it's not true carpal tunnel, like your funny bone, essentially. And the way that I've heard, you know, another doctor refer to it too is like when you have this median nerve that runs down, you have these traffic jams, like what Dr. Shannon talked about, the thoracic outlet syndrome, in the shoulder, the elbow, the wrist. Usually these are places where these adhesions can occur and they can pinch that median nerve, and that median nerve starts to swell. And so when that swelling finally gets to your wrist, it goes through this little tunnel, hence the term carpal tunnel, and it starts to swell and it gets compressed, and that's what can cause a lot of that numbness and tingling a lot of the time. So what's the most common solution for carpal tunnel? You see it advertised on billboards. Surgery, right? And sometimes that's absolutely clinically necessary, that's the case, but it really should be the last option. And you know, when you have carpal tunnel, essentially there's what creates that little tunnel there is a sheet. It's almost a soft tissue sheet, and they go in there and they snip it and allow for that median nerve to continue to swell. And the symptoms can go away, but a lot of times it can come back once scar tissue forms or things of that nature. So what we like to do is find where on this median nerve is that adhesion or that knot or that pinch happening, iron it out, and allow for that swelling to stop at its place of origin rather than just treating the symptom down here in the wrist.
It's a great analogy, that identifying where the traffic jam is, because I have seen many patients, more than it's truly sad to me. They've had bilateral releases of their carpal tunnel, and they're coming into me because they're still having their symptoms, and either maybe they only got temporary relief, and then as soon as the scar tissue formed around the incision, the symptoms came right back, or they didn't even have one single day of relief. It didn't change anything because they thought the traffic jam was here, but the traffic jam was above that, or you know, even higher up, or it was thoracic outlet syndrome. So I'd like to say that everybody approaches things with the same I guess mentality or global assessment as we do, but that's not always the case. Sometimes it is the cure-all, but like I said, our goal is to intervene early enough that when we actually fix that traffic jam, clear that out, all the symptoms are alleviated, and the patient knows how to prevent it from getting jammed up again in the future. Does that make sense? All right. So preventing upper cross syndrome. So when I worked inside of this technology company, I would get a lot of patients coming in and say, "Oh, Dr. Tara, just write me that prescription for the stand-up desk. Write me that. I just need that $2,000 chair. That'll fix all of my problems." Or you should see this fancy mouse. You know, I don't even have to touch it. And honestly, my answer was consistent across the board. None of those fancy tools are going to be what fixes your problem. And that is the lazy way out. They might be a little bit helpful or a little bit more comfortable, no question. But there are just some very specific things that you have to take ownership of and be accountable of and aware of every single day that, like I said, will make you more susceptible if you're not paying attention to those. So, starting with your chair height, okay? So basically, you want your feet to be able to be flat on the floor, okay? So I am short. Even at the shortest setting on most office chairs, my feet dangle, okay? So the simple fix for that is a shoebox. I'm sure we've all bought shoes at some point, so hold on to your next shoebox, bring it in, put it underneath your desk chair, okay? So feet have to be flat on the floor. And what that should do is bring your knee to hip angle to be about 90 degrees. Now, what we typically want to shoot for is 90 degrees or a little bit above. So you can actually have a little bit more bending at the knee, but you don't want to be having, again, your feet dangling. So that's one big factor that's going to allow your hips to actually get into the most ideal position so you can support your lower body posture a little bit better. So that's chair height. Monitors now. So you never want to be looking up at monitors, and people that have multiple monitors, they can be in a tougher situation where they're looking at a bunch of different places at once, but ideally you want your gaze to be directed slightly downwards, okay? If you're looking up, that's going to cause a lot of problems, and I can guarantee I'll see you for tension headaches shortly. So you always want to be having your gaze just addressed a little bit downwards and not too far away. And make sure you've got your vision checked that year, because a lot of the times I'll see people, just because their vision hasn't gotten, evaluated, they're sitting way forward trying to, get a good visual perspective of what's on their screen. So you get your eyes checked, and then they can sit up straighter. But you don't want the monitor to be too close, but you also don't want it to be too far. Keyboard. So I would say so the keyboard and the mouse, this is probably the most relevant to Technet. Basically what you want to see here, she's got a really great 90-degree angle with her elbows at her midline, okay, right at the middle of her body there. Where we go wrong is we put the keyboard out a little bit too much in front of us, so we lose that and the elbow angle drifts forward. So what's going to happen to my upper back tissue when my elbows drift forward? It's going to stretch everything out, making us more susceptible over time. And you have to remember, that's not just a passive process, and most of us aren't just resting our arms on a keyboard. We're actively contracting all of the muscles on the front of our body to hold ourselves there, right? So we can alleviate a ton of that tension simply by making sure your elbows are at your sides and that you're sitting up nice and tall. Now, if your desk is too high, or if your chair is not appropriately fitted to you, you're going to do this. So because your keyboard is not just in front of you, it's also elevated, or it's on a desk instead of a pull-out keypad, right? Then all of a sudden we're activating our upper traps and our pecs, and we're hunching forward. So that just kind of adds to the madness and the chaos. So ideally, when you're reaching for your keyboard, you want it to be within reach of, like I said, just whatever allows you to keep your elbows positioned at your sides, that's what you want. Your mouse, it's basically the same rule. So you want your mouse right beside your keyboard. So literally all it is just a slight deviation to the right or to the left to grab your mouse. You don't want to have to be, and I've seen some pretty terrifying setups of people. They have their stuff all over the place, and that can be a real risk factor for sure. Any questions about that?